We can adopt a systematic approach to interpreting chest X-rays with the mnemonic RIPE AI. RIPE is a mnemonic used to assess image quality, where R stands for rotation, I stands for inspiration, P stands for projection, and E stands for exposure. AI reminds one to use the A to I approach to carry out a structured interpretation of a chest X-ray, where A stands for airway, B stands for bones and breasts, C stands for cardiac and mediastinum, D stands for diaphragm, E stands for effusions, F stands for fields of lungs, G stands for gastric bubble, H stands for Hila, and I stands for instruments. The RIPE mnemonic. R. Rotation. The medial aspect of each clavicle should be equidistant from the spinous processes. I. Inspiration. The fifth and sixth anterior ribs, lung apices, both costophrenic angles and the lateral rib edges should all be visible. P. Projection. Note if the film is antero-posterior, AP view, or postero-anterior, PA view. If the scapulae are not projected within the chest, it's PA view. E. Exposure. The left hemidiaphragm should be visible to the spine, and the vertebrae should be visible behind the heart. A. Airway. Trace down the trachea to the carina. The trachea should be straight and midline. Check for any tracheal narrowing. Trace down the left and right main bronchus. Note if the carina is wider than 90 degrees. Check for any bronchial narrowing or cutoff. Check for any inhaled foreign body. B. Bones and breasts. Trace along each rib on both sides of the chest. Check the clavicles and shoulders. Check the vertebral bodies. Look for any bony fracture. Examine the breasts and soft tissue external to the rib cage. Check for any subcutaneous emphysema. Note if there is an absent breast shadow. C. Cardiac and mediastinum. Trace the left and right heart border. Trace the descending aorta. The cardiac position should be 1/3 to the right and 2/3 to the left. Assess cardiac size. The cardiothoracic ratio should be less than 50%. Check the position and size of the aortic arch and pulmonary trunk. Check the aortic knob. The width of the upper mediastinum should be less than 8 centimeters in PA view. D. Diaphragm. The right diaphragm is usually higher than the left by 1 intercostal space. Elevation of the diaphragm may indicate diaphragmatic paralysis or underlying pathology. Flattening of the diaphragm may indicate lung hyperinflation. Trace the lateral margins of the lung to the costophrenic angles. The costophrenic angles should be acute and sharp. Trace the hemidiaphragms into the vertebra. The whole of the hemidiaphragm should be visible. Check for any free air under the diaphragms. E. Effusions, pleura. The pleura are not usually visible in healthy individuals. If the pleura are visible, it indicates the presence of pleural thickening, which is typically associated with mesothelioma. The absence of lung markings is suggestive of pneumothorax. Fluid or blood can accumulate in the pleural space, resulting in hydrothorax or hemothorax. F. Fields of the lungs. Assess lung parenchyma for abnormalities such as consolidations, infiltrates, nodules, or masses. Both lungs should be well expanded. One should able to count 10 posterior ribs bilaterally. Lung vessels or lung markings should branch out progressively and uniformly. Retrocardiac and retrodiaphragmatic lung vessels should be visible. Don't forget to assess the lung apices. G. Gastric bubble. The gastric bubble indicates an upright position of the patient. Note if there is a hiatal or diaphragmatic hernia. Check for any abnormal air collections within the abdomen. H. Hila. The hilar vessels should be visible clearly on both sides. The left hilum is usually 2 centimeters higher than the right hilum. The loss of hilar point may indicate the presence of lung tumor or enlarged lymph nodes. I. Instruments. Check for any lines, tubes, and instruments such as endotracheal tube, nasogastric tube, central venous catheter, peripherally inserted central catheter, chest tube, pacemaker, implantable cardioverter defibrillator, ICD, surgical clips, etc. In summary, the mnemonic RIPE AI provides a systematic approach to interpreting chest X-rays. RIPE is a mnemonic used to assess image quality, where R stands for rotation, I stands for inspiration, P stands for projection, and E stands for exposure. AI reminds one to use the A to I approach to carry out a structured interpretation of a chest X-ray, where A stands for airway, B stands for bones and breasts, C stands for cardiac and mediastinum, D stands for diaphragm, E stands for effusions, F stands for fields of lungs, G stands for gastric bubble, H stands for Hila, and I stands for instruments.